Well, two questions, my dear friends. First, can exercise trigger a heart attack? Second question, does working out intensely put you at a higher risk of dying? Hello, friends. I'm Dr. Prabhudev, former director, Jayadeva Institute of Cardiology, former vice chancellor, Bangalore University, former chairman, State Health Commission. The answer to the first question, can exercise trigger a heart attack? No. Normal exercise does not increase your overall risk of having a heart attack. Normal heart rate is around 60 to 90 beats per minute. Maximal heart rate is 220 minus age. That is, if you are 20 years, your maximal heart rate at the peak of your work should not be more than 200 beats per minute. Normal exercise is achieving 60% of your maximal heart rate. This kind of exercise is protective. Vigorous exercise is achieving 70 to 80% of your max heart rate. There's no harm in this type of exercise. It's protective. Vigorous exercise will keep you healthy and strong into your senior years. Intense exercise is to achieve 90 to 95% of your max heart rate. Remember, more is not always better. First, prolonged high intensity exercise may increase the risk of death from a heart attack or stroke in those with existing heart disease. Second, it can lead to cardiac events, particularly when performed by inactive, unfit individuals with known or undiagnosed heart disease. Third, intense workout like high intensity interval training achieve 9 to 95% of your max heart rate more than twice a week can be dangerous. It is more so if you risk factors like previous history of heart attack, high cholesterol, if you are smoking, and if you have a family history of cardiac events. Now, coming to the second question, does working out put you at a higher risk of dying? The answer is no. Exercise does not increase your risk of dying from a heart attack. Light joggers and moderate to vigorous walkers certainly have no risk. The most intense runners end up with a risk of dying. The risk is similar to that of those who opted out to stay on the couch. The ideal workout is somewhere between high intensity workout and no workout at all. To maintain rhythm or heart health and to burn off excess calories and to keep blood sugar levels under control. The ideal is closer to the less side of the curve than the more side. It seems like everyone has a story about someone whom they know who suffered a heart event in gym or while out on a run or right after climbing stairs. A 2020 meta-analysis conducted by the American Heart Association and published in the Journal of Circulation highlight the danger of vigorous physical activity, like participating in marathons and triathlons. The agency reviewed more than 300 scientific studies and found that the risk of heart attacks and other cardiac events like sudden cardiac death has indeed risen. These days, more people are running marathons, participating in triathlons, and long distance and high intensity interval training. The risk is highest among the untrained participants. 40% of the cardiac events among the participants in triathlons occur in the first time participants. But remember, exercise is beneficial to your heart health in general. Not everyone needs to give up vigorous physical activity. The benefits of exercise far outweigh the minimal risk of a cardiac event. The relative risk of an attack in people who exercise 4+ days in a week is 1.3 in the scale of 10. Those who don't do any exercise at all, the risk is 6.9. Exercise is protective. A study published in 2015 in the Journal of Circulation found that for the 35 to 65-year-olds who had a sudden cardiac arrest, only 5% had happened during the exercise. This means 95% of them happened while not working out. So you are more likely to have a heart attack sitting on the couch rather than when you are running a marathon. True, heart attacks are caused by a rupture of atherosclerotic plaque with a subsequent thrombus and blood clot formation, cutting off the blood flow in the artery. Fundamentally, we do not know why the stable plaque that was there for years in the coronary artery ruptures, resulting in a heart attack. Exertion does not appear to be a risk factor in the plaque rupture, and the events are likely to be coincidental rather than truly causative. Let us look at the results of London Marathon. One study has followed that the London Marathon for 23 years. Over the time, there has been 7 cardiac deaths and 5 survived the heart attacks during the run. The study found that the risk of death in the London Marathon was 1 in 67,414 cases, a risk which is comparable to many daily activities. If you look at the Boston Marathon, Boston is the world's oldest marathon, has just 2 recorded deaths in its 113-year history. Intense exercise for too long can damage your heart, particularly if you have a genetic predisposition, a low potassium level, dehydration, and you have had a previous attack. The message is clear. Exercise is good, but don't go overboard. A group of conditions known as the athlete's heart. These heart problems are appearing with alarming frequency among the master athletes who are pushing their bodies harder than ever to keep them healthy and strong into their senior years. James Fix, the famous American journalist and fitness guru, dropped dead while out on a 7-kilometer run. Couch potatoes around the world sat up and said with glee, "See, this is what happens when you exercise." Well, hear the story now. He was overweight. He was a smoker with elevated cholesterol levels. He had experienced several cardiac warning symptoms, which he chose to ignore. He also had a strong family history of heart disease. Autopsy showed Fix had several severe coronary artery blockages in all the 3 arteries. In reality, his very high level of fitness had given him an extra decade of life. Your heart needs not rest. Your heart needs work, even after a heart attack. Each day, your heart beats around 100,000 times a day. Exercise has a favorable effect on the heart function. It also is important to dispel the idea that the heart needs some rest, at least after the heart attack. In majority of the clinically stable patients after a heart attack, findings suggest that early exercise may well be the key to the best part of the heart attack outcomes. There are over 30% less likely to experience a further heart attack, stroke, or death. For every additional bout of physical activity a person regularly got each week, his risk of heart attack dropped by 45%. Now, how much is good for an adult to exercise every day? Aerobic activity. Get at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous activity to reach 70% of your max heart rate. A brisk walk can burn up to 500 calories per hour. High intensity interval training is only for those without any previous cardiac event, without any family history of cardiac events, without any risk factors for a cardiac event, and be a non-smoker. Have a qualified trainer. Stick to protocol. Don't persist with prolonged intense training. Strength training at least twice a week. Single set of exercises using a weight or resistance level heavy enough to tire your muscles after about 12 to 15 repetitions. As a general goal, aim for at least 30 minutes of moderate physical activity every day. There is no magic in exercise. You don't have to work out for hours each day. Work out smart and be smart. Thank you, ladies and gentlemen.